This presentation is the neurobiology of childhood stress, focusing on excessive or chronic stress. In this presentation, I will discuss what the medical dictionary describes stress as, what the difference between normal stress and chronic stress is, what are the major causes of childhood stress, both individual and parental influences. I will discuss what the ACE studies are about, the 3 stages of stress, a brief introduction of the physiological model, how stress affects different parts of the body, and what are the typical signs of stress. First, I would like to describe what the definition of stress is. Stress is the physical, mental, or emotional factor that causes bodily or mental tension. Stress can be external, from, say, the environment, psychological or social situations, or internal, such as illness or, say, medical procedures. Normal stress is needed for survival. However, excessive stress or chronic stress is deleterious for health and survival. Some of the stressors that a child could internalize could be things that he sees around him, such as abuse or neglect. It could be towards him or towards a family member or a friend. Exposure to violence, watching movies, uh, watching his parents hit each other, walking outside and seeing gun violence. Um, Chronic disease, such as constantly going to the hospital for any ailments. The child could stress about natural disasters. Say if they live in an area that is frequently by tornadoes, or if a tornado has just recently happened and his family has lost a lot of things, that kind of natural disasters could affect a child. Accidents, whether it be car accidents or an accident at home, any illness or disabilities, the fact that a child can't express something that's happening to him. These are all stressors that a child can individualize onto themselves, which could cause stress. The stressors that the family can put on the child is such as substance abuse, whether there's an alcoholic father or drug addicted mother. Also, domestic violence. That is one unique way that a child can figure out that no matter what's happening, it's somehow their fault, and they internalize that, which causes stress. Mental illness. If a parent has a mental illness, they that could be a stressor for the child. If a parent puts unreasonable or high expectations on a child, demanding they do the absolute best or the most activities, that is another stress that a child can put on top of them. Divorce, again, going back to the figuring out that it was somehow that child's fault. Their parents got divorced. That's a major stress. Single parenting, poverty goes along with that. This parent incarceration doesn't happen quite as often, but it does happen, which causes major stress for the child. The CDC, Center for Disease Control and Prevention, and Kaiser Permanente did one of the largest investigations into childhood abuse and neglect, and later in life health and well-being. They call this the Adverse Childhood Experiences, or the ACE studies, which has been linked to risky health behaviors, chronic health conditions, low life potential, and early death. The retrospective assessment of childhood adversities, the ACE studies, would be smoking, severe obesity, physical inactivity, a depressed state or mood, suicide. The more exposure, the more prevalent the symptoms. So if a child is neglected for 3 years, they might not have as many symptoms as, say, a child who was neglected for 15 years, and so forth. Some surprising things that came out during the other studies were cardiovascular risk, cancer, and rheumatoid arthritis. Here, the CDC and the Kaiser showed an example of the prevalence and certain diseases such as heart disease, stroke, chronic bronchitis and emphysema, diabetes, and hepatitis or jaundice. And you can see that the one with 4 or more ACEs usually had the higher prevalence, the gray lines on each side. There are stages of stress of what your body goes through during these times. The first stage is the alarm stage, where a stressor has been detected and a response made to alarm the body. Adrenaline is produced, leading to fight or fight activity. The second stage is the resistance stage, which is the coping stage. If stress continues, it is necessary to find some means of coping to resist the collapse of your body. In this stage, the body is adapting to the demands of the environment, but at the same time using up all the resources it has. So thus, apparent coping skills are necessary because in reality, things are deteriorating within the body. And finally, stage 3, which is the exhaustion stage. The body can no longer maintain normal functioning. Physiological changes appear such as sweating, increased heart rate, adrenal gland may be damaged due to overactivity. The immune system is unable to cope due to the production of proteins being needed elsewhere, such as, say, ulcers or the depression, cardiovascular problems, and so on. The physiological model is explaining two different pathways uh, that the stress reacts to. So it goes from the hypothalamus in your brain to your pituitary glands and your adrenal cortex. Or it can go from the hypothalamus to the autonomic nervous system, the ANS, to the adrenal medulla. To explain a little bit more of what your body goes through during stress, your pupils dilate to emit more light for more sensitive vision. The mucous membranes of the nose and throat shrink while muscles force wider openings of passages to permit easier airflow, so that if you do need a flight, you can gain in more uh, oxygen. Your endorphins are released. Your hearing becomes more acute, and secretion of saliva decreases. Your heart rate increases. Your bone marrow throughout the body produces more white blood cells. Your bronchial dilates, and your skeletal muscles contract throughout the body. Perspiration increases evaporation so that it cools the body. Your spleen releases more red blood cells. The liver releases sugar into the bloodstream so that gives energy for the muscles in the brain. Pancreas decreases secretion. Adrenal gland releases adrenaline and noradrenaline, resulting in increased blood pressure, increased heart rate, increased fatty acid in the bloodstream, and increased blood sugar. Some of the signs of stress in the physical sense, you can see headaches, sleep disorders, a racing heart, trembling, weight loss or weight gain. The signs of the stress in the mental capacity is constant worrying, forgetfulness, mood swings, a loss of humor, a sense of humor. Signs of stress with the emotional capacity, you can see anger, anxiety, negative thinking, and the signs of stress for behavioral, critical attitude towards others or of others, impulsive actions, withdrawal from relationships, and a lot of people will resort to alcohol abuse during this time.